and function properly, we become dizzy. Any disturbance in the inner ear, with or without hearing loss or ringing in the ears, may cause a feeling of dizziness.
Balance system assessment is conducted to detect pathology with the vestibular or balance system,
to monitor changes in balance function, or to determine the contribution of visual, vestibular, and proprioceptive systems to functional balance.
Vestibular or balance system assessment is indicated when a person has rapid involuntary eye movement, complaints of vertigo, gait abnormalities, or when pathology or disease of the vestibular system is suspected. Visual problems can be determined by two types of specialists. Optometrists examine the eye and prescribe corrective lens solutions. They often catch certain problems and refer them to ophthalmologists.
We as optometrists are trained to treat refractive errors, eye diseases from the standpoint of topical treatment and oral treatments, glaucoma. We work with patients that have eye misalignment, patients with visual impairments. And the way we work together with the profession of ophthalmology, who tends to be more on the surgical side or the medical management. For example, our patient today, Sophie, we would work with them. Initially, they would be seen by the ophthalmologist and taken care of by that particular individual, because if they needed laser treatment of the retina due to the retinopathy of prematurity, they would take care of that portion of the treatment. Then as she's gotten older, just like we see with her today, she needs assistance to see smaller images better. So then we as the optometrist would work with her with magnification in magnifiers or in telescopes or closed circuit television systems. And we'd kind of co-manage her probably her whole life, watching the aspects of the eye health and then the functional vision portion.
We're all used to typical vision tests, particularly visual acuity.
Acuity is clarity.
Reading letters, numbers, and charts at varying distances to determine how well you can see at close and distant ranges. A refraction test is very similar, but with tests that determine proper corrective lenses.
And people are always like, well, how can I get glasses on babies? Well, what we do is a total objective measure. We shine light in the eye, light bounces back out of the eye, and we hold lenses that are concave or convex to neutralize that light, so parallel light comes out. And from that, we can actually make a measurement of a baby's spectral correction.
There are also visual perceptual tests to determine cortical visual impairments, or CVI. This test is growing, and kids with complex disabilities have difficulties processing the information neurologically.
It tests the gateway for the way we digest visual information.
Sophie doesn't need prosthetic eyes because she has eyes, and Zoe and Emma do have eyes, but they're small. The prosthetic eyes are like a contact, but they're thicker, and they're molded to the eye almost like when you go to the dentist and they do a mold of your teeth. It's very similar to that. And what they do is they press on the orbital bones so that the face will grow normally. And they also help for social reasons because, you know, sighted people want to talk to someone who looks like they're looking back to them. In fact, I can tell a huge difference when Emma has her eyes in to how people treat her.
When children are born early, there's abnormal blood vessel growth that occurs because of oxygen issues. And it can start to grow, abnormal new blood vessels will grow into the peripheral part of the retina and start pulling the retina so that it'll actually even twist. And it can detach and pull away from the back of the eye here, and they can end up with a lot of vision loss from that.
Because technology has become so efficient, so far as reading machines and other advances that make learning information easier, there is now a large push to have blind children to read Braille, as there is a growing population of illiterate blind people.
But for all the knowledge that we've gained, the best way to understand the issue for people that are deafblind is to hear their stories.
You're thrown into a whole different world. It's very different. You live in a medical field, you have to learn what different names mean. You have to know, we go to 7 different specialists. You have to live one day at a time, one moment at a time.
CHARGE stands for 6 different birth defects, colobomas of the eyes, heart defects, choanal atresia, retarded growth, and ear problems, either exterior ears or inner ear problems.
It was, he needed the oxygen to survive, but it was also doing damage to his eyes. And so when he had glaucoma and it progressively got worse. He had retinal detachment, probably had 8 to 10 eye surgeries. And when he came home when he was 2 years old, he had 2 more eye surgeries, but progressively his eyes worsened, his hearing worsened to where he was considered totally blind and profoundly deaf.
Edwin has Usher syndrome type 2, which is deaf blindness, initially deaf, and then the blindness or loss of vision proceeds later as he gets older. I'm not sure what age he was diagnosed officially as Usher syndrome. We knew about the deafness when he was 1 year old. And then later on in life, we found about the Usher syndrome or the blindness that came with that. So he's totally different from Jeremy, who is Usher syndrome and spina bifida. And at this, Jeremy's needs were totally different from Edwin's needs. Even though both of them had Ushers, Jeremy having spina bifida presented a whole different set of problems to go along with that.
As a parent back then, we really didn't know where to go.
There's a whole other host of side effects that go with it, like swallowing, breathing, difficulties with all the cranial nerves, so facial palsy, taste, smell are affected or can be affected. Inner ear problems like balance can be affected. So it's a whole host of issues that you gotta work through, either through occupational therapy or through different specialists.
For the first 15 years of his life, they said he had MELAS syndrome, which stands for mitochondrial encephalopathic lactic acidosis stroke-like episode syndrome. Last year, they said, no, he doesn't have it. So we're starting all over again. He has a mitochondrial disorder that affects the muscles and the mitochondria. So he is very spastic, very tight. He's in a wheelchair. He can't control his arms and legs very well.
She had a few laser, few minor eye surgeries, nothing major. And then when she's about 6 months old, I remember thinking even actually that, we're lucky her eyes are okay, because I knew that's one of the things you worry about. At 6 months, she suddenly deteriorated. Just for no reason at all, her eyes became very, very bad. They call it rush disease. Right. And just like that, her eyes went bad. And they really just couldn't do anything about it. And she basically was pretty much lost her vision around that time or in the next few months after that.
And just talking about that, I think there were so many other issues of survival at that time that even the ophthalmologists, however much they might have wanted to do, they were limited in what they could do because of her health concerns. And they also took a back seat because I don't think anyone honestly believed this child would survive.
Because Claire was vent dependent, so anytime we brought Claire anywhere, we had to carry a car battery, a 30-pound vent, an oxygen tank, a suction pump, a food pump, plus all the extra equipment. So we made sure that we stayed in shape, and we brought her everywhere, and we broke several strollers. But, our kids have grown, and they are going to be great people. They are great people. Not many 6-year-olds knows how to suction a trach and change a trach out. And when something happens...
Not that she ever has.
Our 6-year-old doesn't change the trach, but she does suction the trach, yes. Yeah. She helps we have nurses in and out of our house all the time, and my 6-year-old thinks she's the little mama and knows how to do, truly she can do everything, because it's important when you have special need kids that the whole family is affected.
It's been 6 years, and we found each other again.
So I was in a terrible marriage and had a 3-year-old, and I worked full-time and traveled all the time, and my daughter was in daycare.
I grabbed a hold with both hands, and we were off and running, and we started to date. She had just gotten a divorce.
I started thinking maybe